Dr. Salim Sarani joins us live to continue this discussion. Dr. Sarani, always a pleasure seeing you. It's been a while, it seems. If you can, explain to us, are you worried about this? What are you looking at specifically, and what can parents even do to protect their children?
Good morning, John Thomas. Glad to be here. This is a very concerning because, you have seen hepatitis because of the virus all the time. We're very familiar with hepatitis A, hepatitis B, C, non-A, non-B. And we know that most of the time when, especially with the hepatitis A, when it happens, we know what the cause is. It's usually foodborne illness, and we know that it happens in a cluster, and that is one person has it, it contaminates the food, somebody else eats it, and that happens. With the B, we know that usually it's happened with the either the drug usage or oral sexual transmission. So a lot of the time we know what the cause is. This is a very mysterious illness, as you mentioned, and the number is increasing. If you look at it, about a couple of weeks ago, number were in 300. Now it's going in 400 instead of 20 countries. Now you have it in 33 countries. In U.S., well, more than 100 cases has happened, and 5 deaths has happened because of that. The challenge with the hepatitis is because liver is your storage and the food processing plant, what you can call. So what happened is that, anytime we eat the food, whatever the carbs we need, the body stores the rest in the form of the fat, and when the body needs it, it converts the fat into the your carbohydrate. So if that thing is messed up, you don't have a constant supply of the carbs. So that means that, if you don't have a food source, your organ has started crashing. So in other words, when you have a bad liver, if it doesn't heal, you need a transplant. And almost 14% of the patients who has it had the transplant. And most of the folks are involved, they are from 1 month to 16-year-old, and median age is somewhere around 2 years of age. And that is something what we don't see usually in the children, and that is perplexing a lot of the medical folks.
Dr. Sarani, really quickly, do you think we're on our way to a pandemic with this, or are we currently, do you think, in an epidemic?
No, I don't think so. Either we are calling it epidemic or pandemic, because it's whenever you talk about the epidemic or pandemic, it means you see a lot of clusters in a single area. So in other words, somebody has it, and then it involves a lot of people. Here, if you look at it, and if you take a map and you start pointing it out, you don't really see clusters in certain places. There is no geographical connection, and that is what the very mysterious about it. And the second thing is that in a virus, we have it as a lung doctor, we very commonly see those infections, viral infections, but in liver we have seen, but not to that extent. Good thing is 90% of the people who get it, they recover completely without any therapy. You just need to have a good balanced diet, a lot of rest, a lot of fluids, and viral illness goes away by itself. But you need to watch out and seek the medical care. If your baby looks yellow, eyes are yellow, urine is dark yellow, seek some help.
Okay, Dr. Sarani, thank you so very much. You're going to be joining Barbie in the next half hour to talk about the baby formula shortage. There's some alternatives some families are seeking out they're not supposed to. We'll get into that and other details. If you have a question, send us a text to 361-855-6397.